right, we are live.
All right, good morning, committee. It is May 6th. This is the Senate Health and Welfare Committee, and we are meeting alone. We have been meeting with the House Healthcare Committee, but we are now meeting separately. And the topic for this morning is to look at a recovery and response for emergency planning related to COVID-19. Our committee has passed a bill already, S-185, where we looked at regional links, regional healthcare response links for emergency planning related to climate change. And when we went through Irene, obviously, we found out that there were people disconnected from prescription drugs, from medical attention when they needed it. And so we felt that having something in place in S-185 for sort of our regional groups to work together for emergency planning made sense. And as you recall, when we went through that bill, we were beginning to move into the COVID-19 pandemic. And the question was raised, should we expand S-185 to be a full-blown state emergency response bill for healthcare issues? And the decision was made at that time, no, we won't do that. It was a bigger job than we could possibly accomplish during the time we had. So we have passed S-185, which is on the calendar. And now we're moving ahead with further emergency planning related to healthcare. In the meantime, certainly the administration has worked very hard on this public health emergency, and the President Pro Tem has asked to have has a task force working on lessons learned. I'm hoping that those lessons learned can be in some way incorporated into the work that we're doing here with this bill. And of course, nothing we can do can happen without the administration. And so I've invited Secretary Suzanne Young, the Secretary of Administration, to visit with us and to talk about maybe some very preliminary draft responses to the idea of having a recovery response emergency planning bill, and how we might move forward with that. So committee, I'm going to move directly to Secretary Young. She's on a short schedule, a tight schedule, as we all are with COVID-19. And Secretary Young, thank you for being with us. We greatly appreciate your taking this time, and we know it was short notice, so thank you.
Thank you. Thank you, Senator Cummings, and good morning, everybody. It was short notice, but I did have a chance to review the idea that is on the table briefly. But beyond that, I feel like I'm maybe helicoptering into something where I'm not sure where you've been and who you've heard from prior to the pandemic and the work that you were doing in the other areas. So I think I'd just like to give you an overview, and if this is something you already know and you've already spoken to the various persons with responsibility for the state's emergency management response, my apologies, but I would like to just orient today. I just got off, I think it was maybe the 50th or 51st daily update call from our State Emergency Operations Center and our Health Operations Center. Both of those emergency centers are still in full activation. The State Emergency Operations Center activated on March 11th. So we are still in the full-blown emergency response mode, and that's ongoing, and it's ongoing until the state of emergency is lifted, and then we will be moving into the recovery response, which, planning for the recovery, as you've noted, has to start before the emergency is over. And so we have some of our own task force working in that regard. With that said, I guess my first just general takeaway is that in determining, I think what you're thinking about is an after action plan with some action items that the state could implement going forward and to perhaps improve in our response in this type of an emergency, build on our knowledge and our expertise that's been developed. It's an emergency that no one has been through before. It's all new and it's very long and it's a very, very difficult type of situation to respond to compared to something like a tropical storm where you have a storm, you have damage, you can see you can see the damage, you can really quickly determine what you need to fix and what you need to do to recover. So just with that high level context for this conversation, I would direct the committee to the state emergency management plan that is already in place. And again, I'm going to assume that has been part of your conversations. But it is my understanding that once the emergency over, once the recovery is ongoing and perhaps over, I'm not sure how it would happen in this case because it could be a very, very long emergency and a very long recovery. There will be an after action planning process. It is already built into the emergency operations construct. It's built into the emergency management plan. It's called plan maintenance. It doesn't sound like an after action plan, but that's precisely what it is. And it's after any incident in which our emergency management plan is used, there's a review done to review lessons learned, to review how things rolled out, and to make revisions to the plan to correct deficiencies that might be identified during that review. And to, basically, I think, plan for the next, heaven forbid, pandemic of this sort. So what I'm saying here is my first reaction to what the work you're doing is it may be very compatible with the work that's going to happen anyway through the emergency operations center and through the operation of our existing plan. So I would suggest respectfully that having the directors of and those who have been involved in the ongoing emergency response and working on that after action plan would be individuals you might want to consult with through your process. It would be the Health Operations Center as well as the SEOC. I hesitate to offer them up to you right now because, as I've mentioned, they are very much still in the throes of responding to the emergency. They're in full activation and they are totally focused on that aspect of their responsibilities. With that said, I do understand from Director Borneman that they have started to have some very preliminary conversations about what the after action review would look like. But again, they're going to take that next step of planning for that when they're capable and when they are not directed solely at the emergency response. And I understand it's going to be multiple levels of feedback. This pandemic has affected, I heard you mention hospitals earlier, state government, education, the economy. It's just a very, very broad impact. And so any after action plan is going to have to pull on all of those impacted by the pandemic in order to do an adequate job of an after action plan. So that's about, the extent of the testimony I'm prepared to give today is one, is part of the planning process. It will be something that will be happening. Your concept seems compatible with that, but I would want to make sure that you're communicating with those who are going to be doing the work and are actively, trained up and ready to do that kind of work.
Thank you. Thanks for your comments. And we have looked at the emergency management plan that has health related issues very low on the totem pole. So it hasn't been something primary, and we're going to hear a little bit of testimony later about that. And we will, as you might suggest, we have not taken testimony on this bill yet. So it's the beginning. And so we're hoping to coordinate any of our efforts with efforts that are being taken by the administration. And we appreciate your comments. Committee, any questions for Secretary Young at this point? I think you've hit the nail on the head when you said that everyone is too busy to drag them in for a conversation. And that is one of the reasons I know you're too busy too. But the position that you're in gives you that broad umbrella look at everything that's going on in state government. So it's very helpful to have your perspective.
And I guess I would suggest, I did see, some of the timing that you're thinking of, and again, I think depending on how long this emergency is in state and how long the recovery lasts, they may be too aggressive, timelines that you're thinking about. I can't speak to that. I don't think anyone really can until we know where we are in a few months. So another suggestion would be, maybe this isn't critical for this particular, part of the session, but maybe over the summer as things are unrolling and we have a better look at what's going on, getting in the emergency response experts and figuring out the timing would probably be more beneficial because we'll know more. And they may not be let's hope that they're not in an emergency response this summer.
Yes, thank you for that.
Thank you.
I completely agree with you. And as the legislative working group is gathering data and others are gathering data, it does make sense to extend any conversation about this kind of bill until we have some certainty. We're never going to have full certainty, but to have some certainty. So thank you. Committee, any other questions for Secretary Young? Okay. Thank you very much for being here. Any other final comments?
No, you're welcome. And thank you for including me this morning and accommodating my schedule. I appreciate it.
Thank you. And we will reach out to emergency management folks. I know how busy they are, but we'll try to include them in any conversation that we have. It's absolutely necessary.
Okay, thank you.
Thank you.
Goodbye. Have a good day.
You too. Take care. All right. So committee, I asked Katie to draft up a bill related to recovery response and planning, emergency planning. And I thought I'm sort of ambivalent right now, but I also invited Abby First, who is the intern from UVM, who was listening in and working with us on S-185 to come in and offer her testimony. It's the work that she did during the semester. And I think that you'll find it enlightening. So I'm going to ask Abby to speak first, and then we'll move to Katie and look at the language, drafted language. So Abby, welcome.
Thank you.
It's good to see you again.
You too.
And we're all happy that you're well.
Same here.
Yeah.
Because I'm down in Westchester.
Yes, you are. You're in the thick of it.
It was. So for the record, my name is Abby First, and thank you, senators, for giving me the opportunity to speak about developing a direct action that can help Vermont be prepared for climate change public health concerns. So currently, Vermont has a state emergency management plan and a hazard mitigation plan. In addition, many towns have adopted local emergency management plans and local hazard mitigation plans. All these plans address risks and vulnerabilities the citizens of Vermont are exposed to, make the state more resilient for future natural hazards, which are expected to increase with climate change. These plans do not tend to focus on the public health issues associated with the hazards. Even though climate change is expected to impact human health in many ways, for example, the 2018 Vermont State Hazard Mitigation Plan uses the word health only 16 times in its 159-page document. Some health issues relate to the fact that in the past 50 years, Vermont has seen an increase of 2 degrees Fahrenheit in the summers and 4 degrees Fahrenheit in the winters due to climate change. These issues include respiratory problems from longer pollen allergy seasons, an increase in vector-borne diseases due to lengthening of the season for mosquitoes and ticks, habitual changes for Vermont residents who are not accustomed to the higher temperatures. In addition, the Vermont Department of Health notes that in the past 50 years, the annual precipitation in Vermont has increased by almost 7 inches. More precipitation can be harmful for vegetation and can cause municipal sewers to overflow, which results in overload of coliform bacteria that can make people sick. Also, extreme storm events can cause injury, water contamination, mold growth, respiratory health issues, and long-term mental health impacts. The current state hazard mitigation plan does not place enough emphasis on the public health impacts of climate change impacts. However, S185 would address this. Currently, the entire world is battling coronavirus. This infectious disease demonstrates the need for inserting public health standards into a plan. Though it is too early to conclude a correlation, there may be a relationship between climate change and COVID-19. In fact, a recent study is in review that demonstrates, quote, a clear link between long-term exposure to pollution and COVID-19 death rates, end quote. A public health risk like this can have a significant impact on so many people and parts of life. COVID-19 has raised the nation's unemployment rate at an unexpected speed and scale and has caused thousands of deaths across the country, with both numbers rapidly increasing daily. There is no better time than the present to support a policy that focuses on the need for public health to be better addressed in climate change response plans. Draft number 4.1 of S185 in your committee, the Senate Committee on Health and Welfare, currently in May 2020, states that the Department of Health and Chief Prevention Officers need to work together to, quote, develop and adopt a statewide climate change response plan to foster resilience to the impacts of climate change in Vermont, end quote. This bill focuses on preventing and mitigating public health risks caused by climate change, with a specific attention to vulnerable populations. As S185 states at this writing, multiple stakeholders will develop a climate change response plan using a public health model. Although not stated in the current version of S185, this climate change response plan should be incorporated into the state hazard mitigation plan to ensure the state is aware of and prepared for the public health risks of hazards. Because the state hazard mitigation plan is subject to review and revision every 5 years, the climate change response plan would be reviewed on a regular basis. These actions will help the state understand how to better handle public health issues that may occur in the future. And due to the substantial impact COVID-19 has made on the world, I recommend there also be a re-evaluation of the risks of infectious disease outbreak in all current emergency management and hazard mitigation plans. In the 2018 Vermont State Hazard Mitigation Plan, infectious disease outbreak is seen as a hazard with the second lowest impact on the state, only above hail. The plan states, quote, given the steering committee's low ranking of infectious disease outbreak in the hazard assessment, there are no actions in this plan that specifically address the hazard, end quote, which is ridiculous. After the COVID-19 outbreak, mitigation strategies should be identified to respond to an infectious disease outbreak like this in the future, based on the state, nation, and world's experience with COVID-19. It is unknown if the virus is a direct result of climate change, but it has exposed a gap in the current Vermont hazard plans. A substantial challenge of S185 is that it requires additional work from multiple stakeholders to create plans of action that relate more fully to public health risks. Even though it may require additional time and resources to develop such plans, the plans would be instrumental in the long run, as Vermont will be better prepared for disasters. If we do not act, the health issues could worsen and impact more people throughout the state, as we've seen with COVID-19. It is also important to recognize that it will be best to wait to add infectious disease sections to mitigation plans until we have fully experienced the impacts of the current COVID-19 outbreak, which we just discussed. It is important to wait until COVID-19 is completely eliminated so the most knowledgeable people on this issue will no longer be preoccupied with handling the virus in a moment. We'll also have a fuller understanding of how to more effectively mitigate a disease like this in the future. Thank you.
Thank you, Abby. That was excellent. And obviously, we're not following your last recommendation. We're probably not going to wait, but we certainly, the timing is critically important, as you know.
Mhm.
So thank you for that. Thank you for your good work during the semester. I
Mhm.
think I have seen your research paper and the references that you used, and I'm going to ask you if you would mind if I share that with the rest of the committee.
Yeah, of course.
All right, good. And of course, our ledge counsel. Senator, I think there are questions for you. We understand, of course, that we're not taking testimony, particularly about S-185, but there are lessons to be learned from your testimony with respect to future planning for as a result of COVID-19. So,
Mhm.
Senator McCormick.
Thanks. Senator, the chair's last remarks may have been a promise to answer this question, but you referenced a study indicating a connection. Okay. Could you tell me what that study was if I wanted to go and look at it?
Yep. So it was a New York Times article from, I don't remember the exact date, but it was towards the beginning of the whole crisis. And they just found a connection between the amount of air pollution and the amount of deaths. That places with more air pollution had more deaths due to corona.
Okay.
But that study is still under review. It's still too early to conclude if that's completely accurate.
Could you perhaps just memo us or email us
Yeah.
what
Is that
the
in your,
references there?
is that in your references for your
Yes.
project? Yeah, sure. We'll get it. We'll get the whole thing
Yeah.
to you.
Okay, thanks.
Okay.
That's all.
Any other questions? Senator Ingram.
Yes, thank you. It's great to see you again, Abby.
You
Thank
too.
you for being here. So one of the things that I found interesting about, the stay-at-home orders and, large populations now not being as active, as we were. Some of the more famous ones, shots of the mitigation of air pollution in New Delhi, for instance, or, are there any articles or studies yet sort of looking at what, it's not just risk, but actually maybe some benefits to, combating some of these, either natural disasters or this kind of infectious disease, in sort of additional benefits to our response to the problems themselves.
I've not seen specific information on that because that's not what I was looking for, but I do know we've seen changes to the way we've impacted the climate for the moment. Who knows if they'll have a long-term impact, and we just have to make sure we keep this lower impact in the future. And we're still at risk for the typical hurricane seasons and flooding seasons that I expect to occur soon.
Yeah, it's fascinating to me that, some of the things you hear about animals are flourishing, in ways that they didn't because the human population was obstructing them and that sort of thing. It's fascinating. Thank you.
So, and I will say from my own reading, I've been doing a lot of readings, journals and so on, that there are a lot of people looking at this. And so we'll see some outcomes as a result.
Good. Yeah.
It's a little, it may be too early right now to know anything about, but we can get chunks like the clean air in India.
Yeah.
That's good. All right. Any other questions for Abby? No, we're good. Abby, thank you so much. We greatly appreciate the time that you've taken to be with us. And if you want to stick around, you're welcome to do that. Just make sure you mute yourself, and you can stay as long or as little as you would like for our committee meeting. And
Great.
we greatly appreciate the work that you did on this. And it was interesting to me to see how, after COVID began, how your focus really got targeted. And it actually improved and became very real.
Mhm,
Yeah, so it's good.
mhm.
Thank you.
Thank you.
Okay. So Katie, you have drafted some language for us. Just a heads up for everyone. It's pretty bare bones and simple. And but I think Katie did an excellent job at bringing us some language that we can begin to look at and consider how we want to proceed, who we want to hear from, and the timing that we might have for that. So can we get that up?
Yep, I will bring it up now.
Katie, do you want to have any introductory comments about the bill? I know you had discovered some things regarding mitigation planning and others, so why don't you share with us your thoughts and then go through
Sure,
the draft.
sure. Well, that's sort of a separate issue, but when you first brought the idea of trying to combine this concept that we're going to look at in the bill with the hazard mitigation plan, I looked in state statute for references, and there is one passing reference, and it's more of a federal creation. So in the end, after you and I had an opportunity to discuss this concept a little bit more, you decided that this would be best as kind of a standalone plan to be able to do what you really wanted to do with this language. So the bill that we have in front of us really does two things. The first piece is that it's collecting data. It's asking Vermont departments and agencies to look at their response to the pandemic and to submit data to the agency of the administration about their response. And the second piece is using this data that the departments and agencies are collecting and creating a task force to have kind of a wider scope of lessons learned and how to prepare for a future healthcare emergency. So, oh, I can't scroll up. Nellie, do you mind scrolling up, please? Great, a little bit further. Okay, if you could pause right there. So first, as I said, the first portion of this bill in subdivision A1 is requesting that by January 1st of this coming year, the Secretary of Administration will begin to consolidate data collected by each of the departments and agencies that were involved in Vermont's response to the pandemic regarding their department or agency's role in responding to the pandemic. And then on the next page, we go on to list all of the specific things that the agencies and the departments are to be collecting. First, in subdivision A, they're collecting policy modifications that were implemented in response to the pandemic, including the effectiveness and limitation of each of these modifications. In subdivision B, they're identifying populations, regions, or infrastructures that would have benefited for more timely or robust state interventions, or both. Subdivision C, the agencies and departments are looking at alternative responses and policies that would have better served Vermonters than the approach that was taken or not taken. And subdivision D, looking at opportunities to prevent, mitigate, and better respond to future healthcare emergencies. And in subdivision E, the agencies and departments are to report on any other relevant information necessary to ensure that Vermont's experience informs future statewide healthcare emergencies. So that's the data that we're asking to be collected beginning on January 1st of 2021. And if we scroll down a little further, yep, thank you. There's subdivision 2, which says that by August 1st of 2021, so we have a 7-month window there, the responsive departments and agencies are to submit all data required by that we just looked at in subdivision 1 to the Secretary of Administration. So we're basically giving a 7-month window between January 1st, 2021 and August 1st, 2021 for the agencies and departments to collect all of this data and submit it to the Agency of Administration. So that's the data. Subsection A is the data collection portion. Then we move on to subsection B, and this moves into the creation of a task force. So by August 1st, the Secretary of the Administration is to convene a task force for the purpose of evaluating Vermont's response to the pandemic and developing a strategic state plan for addressing future statewide healthcare emergencies. Subsection C lists all of the members of this task force. So it's quite a lengthy list to try to capture kind of a multidisciplinary approach, all aspects of state government that was responsive in the pandemic. And if the committee decides to move forward with this language, it might be worthwhile to spend some time looking at this list to make sure we haven't left any potential responsive agency or department out. Although there is a catch-all that we'll say. So first in subdivision C1, we have the Secretary of the Administration serving as chair to do this work. And then in subdivision 2, the Agency of Human Services or a designee. Thank you. Subdivision 3, the Commissioner of Health. Subdivision 4, the Commissioner for Children and Families. Subdivision 5, the Commissioner of Dale. Subdivision 6, the Commissioner of DEVA. Subdivision 7, the Commissioner of Corrections. Subdivision 8, the Commissioner of Mental Health. Subdivision 9, the Commissioner of Public Safety. Subdivision 10, the Secretary of Education. Subdivision 11, the Commissioner of Labor. Subdivision 12, Secretary of Commerce and Community Development. Subdivision 13, the Secretary of State. Thank you. And then subdivision 14 is any other person the Secretary of Administration believes would be helpful in carrying out the task force's charge. So 14, subdivision 14, we have a catch-all. That doesn't mean that the committee might not want to be taking a careful look at this list. And also it's worth noting that I didn't read that a designee may be substituted for the secretary or the commissioner in each category, but that language is there. The commissioner or secretary could send a designee with the exception of the Secretary of Administration who's chairing this task force. In subdivision D1, there's language that the task force would review the data submitted pursuant to the language that we looked at earlier in subsection A to create a strategic plan for addressing any future statewide healthcare emergencies that may arise, and that by November 1st of 2021, the task force would submit a proposed plan to the General Assembly highlighting any legislative changes needed to implement a final strategic plan. And then in subdivision D2, this is an opportunity for the General Assembly to weigh in on the work of this task force. So by June 1st of 2022, after soliciting input from the relevant subject matter committees in the General Assembly, the task force would adopt a final strategic plan for healthcare emergencies. In subsection E, the task force has the support and assistance of the Agency of the Administration. And in subsection F, subdivision 1, the task force is to convene not less than 4 times to carry out this work in creating a proposed strategic plan and a final strategic plan, and the majority of the membership would constitute a quorum. This act would take effect on July 1, 2020.
Okay. Am I muted? No. Okay. Thank you. So I'm going to ask one question first, and then we're going to go right, because I see Senator McCormick's hand is already up. So Katie, the question I have is, you mentioned early on that the hazard mitigation plan is really mentioned once. It's more of a federal requirement. And then the state, we understand that the state has an emergency management response.
Mhm.
Is there a way that we can distinguish between those two? How do they fit together? Do you have that information now, or is that something we need to go after?
I think that's something you're going to want to hear testimony on, what currently exists with the state health emergency center
Yeah.
And not a great time to get testimony from the people operating the center about their recovery efforts, but that is information you're going to want to understand before moving forward with this bill.
Okay, thank you. All right, Senator McCormick.
Thanks. Katie, what's the reasoning behind not allowing the Secretary of Administration to name a designee?
If that's the committee's choice, there's no problem with allowing the Secretary of Administration to have a designee. The conversations that we had sounded as if the Secretary of Administration would be the point person on this work. So I didn't give the Secretary a designee to make sure that the Secretary would remain the point person, but that
All
is the committee could of course change.
Yeah, maybe that the chair is so central to the committee's work that we don't want anyone any lower in the pecking order, but just so we talk about that before we pass the bill.
Yeah, yeah, as I talked with Katie, it became clear that if you're going to be asking other secretaries to do something or to bring something to you, you're right, doesn't make sense to have someone in a lower level position unless it's agreed to somehow. Senator Ingram and then Senator Cummings.
Thank you. Yeah, I was just looking at in section 1 on page 2, the B on line 3. I wonder if we could maybe make that a little more robust, maybe break it into two items, because I think it would be really great to focus on particularly how different populations have been affected and really maybe name them.
Can you cite that what reference you had? I just got my iPad back on.
Oh, sorry, sure.
Wh-
Page
where-
2.
Page
of the
2.
bill. Yeah, line 3, item B.
Okay.
Just to make sure, maybe actually name some of the populations that we particularly
Okay.
want, by race would be my top one that I think we should look at, but also maybe people living with disabilities or homeless, those incarcerated, that just to make sure that's really highlighted.
Good suggestion. Senator Cummings. Senator Cummings, you're mute.
Sorry.
Okay, there you go.
All right. I just have some concerns with the timing. We're looking for tying up, sounds like almost every secretary or administrator in the state of Vermont to produce a very comprehensive report by January. None of us are
No, begins January.
It begins in January.
Yeah, so the Secretary of
better.
Administration,
we're not sure this is over.
No, it won't be over for 3
And-
years.
A substantial part of that should be the recovery. Because just
Okay.
saying, the point is, what we learn, how do we recover? We are definitely not going to be through recovery. And I know the governor already has a recovery group together for business recovery. And just, we also, the hazard mitigation is a federal FEMA
Mhm.
program. We want to make sure we don't do it, but mostly I don't want to stretch out our limited personnel at a time when I think we're still going to be needing them. I'm not at all. I mean, if we're going through a second phase of this next December,
September.
yeah, I mean, I know we all want to get out there and do something, but this is,
So so clarify.
it just concerns me.
Okay, no, it was the comment that the secretary made, and it's a good comment. So the question is, how do we have collection going on and the data being saved over time, and then initiating something in a timely fashion so we're not tying people up? I think that is exactly the right question we should all be asking.
Well, don't we have a task force in the Senate that we've charged with looking at what we need to
I'm not sure they're going to come up.
collect or keep or learn?
Yes, and that we're hoping that that group will inform this. I'm hoping anyway. After I started thinking about this legislation before the task force happened, but now that the task force has happened, I think it would be very helpful to have them informing whatever we decide is final legislation. I don't think this legislation is going to be finished anytime soon.
Okay.
You know, I'm not looking at this as one of these immediate COVID pass bills. I'm looking at this as more of the long-term end of session kind of bill when we have a better grasp of
Okay.
all the issues, and especially the ones that you brought up. I think those are absolutely critical. So yes, thank you for that. Questions? Senator Westman? Comment, question?
You know, the direction of this in collecting information is that it is a long-term endeavor. That's the only comment I would make. You know, for me, it's let's see what the testimony that comes in.
Okay, that's good. I would agree with you. And I think but the first thing we need to do is kind of sort out the relationship between the hazard mitigation plan and the emergency management response. And, you know, when we've listened to people testifying about the emergency response, where people are isolated during the COVID, where people are isolated from healthcare and access to broadband, that's something that Senator Cummings and I are both very interested in. We're all interested in. And then we're also aware that the PPE was unavailable. We understand that policies around nursing homes weren't in place. And the question would be, do those policies get put in place on a more permanent basis going forward? And if so, how? So there are all of those questions about policies also related to things like licensure or when specific parts of the economy open up. Some of that we've had our hands on, but some of it has very much been the result of executive order. So there are two levels here that we need to be concerned about. Not just two, there are 100 levels. Anyway. Good. I guess my next question, we're not going to spend much longer working on this morning, but what I would like to do briefly is to ask you and your creative thoughts right now, how you would like to structure testimony on this. Who would you like to hear from regarding this? So I call it the Recovery Response Emergency Planning Bill. And I will share with you, this morning I read a long report that was done in the state of Hawaii, very much like what we're thinking about. I happened to step on it because I belong to an international group that sends me things, and this came from that Pacific group. So this is happening in other places. So question I have for you is, who would you like to hear from? Go ahead. Just, you can leave yourself off mute and we'll try and have a discussion. Senator Ingram, you had your hand up.
Thanks, yeah. Well, you know, I was thinking maybe we could focus on some of the people in the departments who collect data, some of the numbers crunchers, because they might be a little less busy with actually addressing the, you know, the pandemic at the moment, and would have a good perspective on how, you know, how to collect this data moving forward and how to analyze them.
I think probably that leans heavily on the Department of Health and how that data is collected.
Maybe David Englander and
Probably. Dick, go ahead.
Thanks. I don't know. I wonder if we actually have to have testimony, maybe just ask for comment. An email would be fun because these people are busy. But I think we should hear from anyone on the list. This is sort of along the lines of what Ann was saying, which is that, these people have an awful lot to do right now, and we may be getting ahead of ourselves. And I'd like to hear from people like, are you able to do this? Do you think this is a reasonable demand to make on you?
Right. In the future. We're not asking, we're asking them to
Yeah.
keep track of what they're doing, but we're not asking them to collate data until later on. Like,
Yeah, well, then we should ask them when they think would be a
Yes.
good time to get started.
absolutely. Okay, so time.
Okay.
Yep. Good point. All right. Clarification.
I'm finding myself getting annoyed with citizens who are calling me for help with unemployment. It's like, Jesus, don't I have enough to do? Leave me alone. And I'm sure these people are feeling that way as well.
Oh, everyone is under such stress right now. It's totally understandable.
Yep.
So I guess maybe but I think we should start out with distinguishing between what the hazard mitigation plan is and what the emergency, state emergency plan is, and who's in charge of those. Remembering, and I think, remember what Abby had identified for us, and that is that healthcare issues were the second lowest on the list for emergency planning. Now they're going to rise up much higher. And so it's a new world. It's a very brave new world for emergency planning. My personal thinking is that because it's a new public health world for many people, it's not new for public health people or for us, but it's new across the state, that we should keep our finger on the pulse for this one. Rich, do you have any comments or concerns or questions?
He keeps ducking up and going like this on me. They've raised exactly. I think this all needs to be done. The question is, how do we do it when we're not in the way of the people doing their work? And but we do have to do this at some point.
Right. Yeah, I think the timing issue is probably key. I suspect right now that the governor's task force is beginning to collect data, and so that's a good thing. But then collating it all, putting it together so we get a comprehensive look at public health emergencies, I think is important. I guess my fundamental question for you as a committee, is this something worth pursuing for our committee over the next 6 months?
Well, yeah, yes. I mean, it's very important. That something be, I mean, the secretary made it sound like, of course they're gonna do it, but I think it's important for us to weigh in and say, we need all this information from all these different parts of the government, and we need to make sure that we're learning lessons from this, and not just responding in an urgent mode. And the timeline is, I was glad to see it's from January to next August is, so I mean, I think that
it's even too compressed. I think it's too compressed.
Yeah.
Anne, go ahead. You're muted, Anne.
I'm too good. I think we need to collect the data. Somebody needs to collect it. What's throwing me is I'm not sure how we're working on it over the next 6 months. were going to get sent home in the next few weeks. Some of us are coming back in the fall. It might just be the appropriations committee or the money, I'm not sure, but we have to do a budget. And then some of us, there is an election in November. Some of us won't even be back in January. And those of us that are back may not be on this committee. So how we structure this, but we're not going to have a 6-month period of time. It's not like January where we're going through it. So how we structure it,
Well,
we may have to be patient because all of those emergency management things are pretty much set up for natural disasters.
yes, they are.
Yeah. And it's been 100 years since we had a health disaster. And it will take a while. Then it'll be a national thing to figure out what is the best response. And we're part of the nation. We may be able to do what we've learned to help the nation, because in some ways we're in better shape, but that may be because we're rural. The bulk of our cases have been in our one populated county. That may be why the exposure to pollution shows up, because cities have more pollution and people, I mean,
Oh, we're a very clean
it's
county.
the cause and
Very
effect. We don't know, but it's how do we document what we did and the outcomes of what we did, so that we can be prepared to talk as part of that national discussion. Because we aren't Hawaii, we aren't an island. We can't just close our borders like New Zealand. I think we're going to have to. So right now, we just need to make sure we're documenting what we're doing.
I think so. And I think the other thing that comes to mind while you're talking, if we document what we're doing, and I do think we're probably going to have to do it before adjournment. And that's why keeping it simple, it makes sense.
Very simple.
The data collection and the dates, so that the dates are far enough out that when any legislature comes back, they can dive back into it and look at it. But an emergency plan, as you said, Ann, is all about some environmental disaster, and it's less about public health and accessing healthcare for people. So making sure that there are, and I think of, the whole childcare issue and related issues, putting some criteria or some inkling of healthcare in the emergency planning process is really important.
And some of the things, we had a particular approach to our homeless population. So in the end, did our homeless population have less COVID-19 than the places that just left them to fend for themselves? Was this a serious vector of disease? But it would inform us if and when there ever is another. And those areas we might be able to get are ones that the health department might not at this point be collecting information on, and ones we might ask folks to start keeping records.
Well, that goes to Debbie's comment about enumerating populations and groups. Yeah. So that's helpful. Very helpful. All of this is really helpful. So, I think, who's in charge of the governor's task force? Do we know?
And it's on economic recovery.
Yeah, that's true. It is.
The only person I know that's on it is Tom Lozon,
Okay.
former mayor of Barry.
Yeah, from Barry. Yeah. Okay. Dick, go ahead.
Yeah, but also, how does this relate? Maybe it doesn't, but how does this relate to the legislative task force? On, what did we get right? What did we get wrong?
I think the legislative task force is really looking for the details and looking for policies, looking for what happened to help people. I'm not sure we can put all of that in legislation, but what we could put in legislation is reference to that task force and the work that they've done. Because some of that task force work is going to inform the appropriations process, and some of that task force work, that little working group is going to, well, it'll inform us. They're coming back to us first, but then it'll help us make recommendations to joint fiscal and make recommendations to appropriations. So we can also, during the development of this bill, refer to any of the task forces that are currently collecting data or making recommendations.
Mhm.
So I don't see that working group doing exactly what this bill has in it.
Well, and Senator McCormick, you're on that task force, right?
Yeah,
Communicate that we're thinking about passing this bill, right?
yeah, we're just, the legislative task force is just getting started. We've
Sure.
had one meeting of an organization
Yeah.
kind of nature. I'm wondering if we might just want to tell the bureaucracy to prepare, each bureaucracy to prepare to make a report to the legislative task force, rather than set up a second task force.
I don't know what you're saying. Can you clarify that?
Yeah, we have now a long list of agency heads who are supposed to either be on the task force or designate someone to, and they're going to do a whole study, do a whole report eventually. On the other, you've already got a task force supposedly doing that. We could just put the various agencies on notice that at some point the legislative task force is going to want information from them, that they should be keeping records specifically. I mean, obviously they keep records. They keep records specifically addressing the question of, what did you do? Why did you do it? Did
Well,
it work? Did
yeah,
it not work?
Yeah.
Why do you think that is?
Yeah. I think that is one of the points of passing the bill pretty quickly, so that notice is out there. I can't speak for what you guys are doing on your task force. I think that's a separate issue, but I do think that passing a bill like this gives a heads up, allows for data collection, suggests some of the data that we're interested in preparing an emergency plan that includes people and healthcare. And then the timing of it that we're all concerned about, it can be a time later on when the next legislative session begins and allows people to review what's there and to take testimony. I
Yeah.
think this is the beginning of that process.
Okay,
Yeah.
I'm reluctant. I want to make sure that we don't add to the burdens of people who are already overburdened, in particular if we don't have to,
Well, I don't want to do that either.
obviously.
Yeah. And I'm thinking that the timing of the bill is key to ensuring that we're not doing that. But I can't imagine that Corey Gustafson in DEVA right now doesn't have an enumerated list of when each policy went into place and keeping track of
Yeah.
what's happened. So, and I can't, or any other agency or department, I think they're looking very closely at what they're doing, and then go out to hospitals or other folks. So it's a heavy lift for everybody.
Good.
Any other thoughts? All right, so we'll start out with clarification of the hazard mitigation plan versus the emergency plan. And then I think we will call on the Department of Health, and possibly David Englander is the best person. He always seems to be very generous with his time, and get his thoughts. And then I would really, I would also ask you for your thoughts going forward, who you'd like to hear from, how we can improve the bill. And as I said, keep it simple. And go
Jenny,
ahead. Yeah.
have we gotten permission from, is it rules?
I haven't got, no, I haven't, I need to, I might bring Tim in. I'll talk with Tim about this. I haven't
Yeah,
talked with
because
anyone.
I last time I voted something out, I had to get permission
Sure.
to do it.
Yeah, no, we have to have permission for whatever we do. We have a
Okay.
couple of bills coming up, and I did indicate when I sent our priority list, I sent a list out of the bills that we had passed and are on the calendar. I think most of those bills I suggested were priorities, or bills that we've passed out of committee. And I also put in an emergency planning bill. I just said we're
Okay.
working on that. So it's not that it's unknown, it's just that this is fresh to us, and we'll have to make sure that our leadership also understands what we're trying to do.
Okay.
Yeah, thank you. Before we quit, and we are going to quit early today, first, listen, unless there are other comments on this bill. Okay. Can we say thank you to Katie for the work she's done on
Yeah.
it? Yeah.
Yes, thank you, Katie.
A lot of good thinking went into that, and we appreciate it. So first, thank you for your work while we've been meeting jointly with the House Healthcare Committee. They will be meeting with us again tomorrow. One of the issues that we're looking at tomorrow is an issue that actually our committee has sort of worked on independently. Two of those. One is the prescription drug from OPR, that their order on medications, and the other one is on healthcare provider access to funds for patients and broadband and IT equipment. So those two issues we've been working on independently, but they'll probably be interested in those as well. On Friday afternoon from 2:30 to 4:30, I think it's 2:30 to 4:30, but it begins at 2:30. Human Services in the House is having testimony on childcare, and I intend to be there. If we have a quorum of us, if you want to attend, let me know, and we can make it a joint meeting.
What time is that?
2:30 Friday afternoon. And let me know. Huh?
I will, I'll let you know. I need
Okay.
to check with appropriations because we started the budget adjustment.
Okay. So just let me know, committee members, if you are going to be there, and I can let Ann Pugh know, and then we can have a joint, we had talked about a joint meeting and the time has gotten changed, so.
Yes, I was asking about that because originally you said something about noon to 2 tomorrow.
Thursday, it just got changed from Thursday to Friday.
Oh, okay, all right.
Yeah,
That's
I didn't send a note out. I thought I'd just bring it up.
Okay.
So let me know, and we'll work on that. I intend to be there for that one.
I can be there if. can I-
Okay,
no, so
that's
I-
two of us, almost a quorum. And you, Rich, you'll let me know?
I definitely will let you know, but
Okay.
this afternoon when appropriations meets before it
Okay.
starts, I'll ask Jane and then I'll
Okay.
email you.
Terrific. Okay. Then I think that's it, but now I've sent a couple notes out to you, and each time I've asked for you to send me your creative ideas that we can advise joint fiscal and or appropriations regarding how we might use the CFR, the CARES federal relief funds. So if you could, and Ann, go ahead.
No, I was just gonna say, the way it is set up with joint fiscal right now is that the administration, well, they've got money,
Uh-huh.
75 million to cover what they've already spent and what they've committed for. They've got, I think it's 150 million that they will have to have pre-approval from joint fiscal on, but all of that's coming from the
Okay.
administration.
Is it
In
helpful?
the rest will be going through the regular appropriations process.
Right.
So as they work through budget adjustment, if it's immediate, or as they work through the first quarter budget.
Right.
But that's where the action is going to be pretty
With
much in
appros.
appropriations, as it usually is.
So I guess my question is it helpful then to send you any information at all on joint fiscal?
Not if there's a proposal from the administration,
Uh-huh.
then it would be helpful, because
Okay.
and as I understand it, it's going to be dealt with like joint fiscal now gets any grant request. It will
Right.
get posted, and then everybody should get an email so you can read it. And if it's something you have want to have input in, let me know and we'll get you on the agenda.
Okay.
Or the agenda, I mean, the idea is it will be run by the chairs of the committees of jurisdiction.
Right. That's typical.
So,
grants.
but
Yeah.
yeah, I mean, we're thinking in the next 3-week time frame. Nobody's started to say, so is joint fiscal going to meet every Monday for the rest of the year? I'm thinking about it. I'm thinking, since we've told the administration will be available weekly or more often, that may be a committee that'll continue to meet.
Okay.
But that is still up in the air.
Okay.
Okay,
All right.
I'm
So
on
I get,
everything else.
I have been getting grant requests, and if I agree with them, I sometimes don't even respond. I've done
Yeah.
another. Graham Campbell just sent me another one, and I've been looking at that. So,
There
but
was one we did for mental health yesterday.
yeah, without the mobile unit one.
I know it already started.
Right. It's a good one. It's a very good
Yeah.
one. I didn't
Yeah,
respond.
that was
That's
just pro forma. It
Yes.
didn't even get a presentation.
No.
It just went.
Yes, it was good. The other, I guess, regardless, joint fiscal now, we have our feet on the ground with that one. And I'll be busy with that, I know, and if I may reach out to folks with questions going forward, if there's a proposal from the administration that perhaps the whole committee should look at. But in terms of making recommendations to appropriations, please start to prioritize the things that you believe are important. We have a lot of issues. I've been getting emails, as you have, about spending money on PPE. Yeah, go ahead, Rich, go ahead.
So what I would say to you about that is the 150 million that joint fiscal is doing is, we put kind of a little fence around that.
Yeah.
And it's going to be more stuff like paying the state colleges for the students that they owe.
Right.
The budget piece is probably not till a ways from now.
It isn't.
Because they've got to figure out what the COVID money is, what we have for money, and how they backfill each other. And that will only be for July, August, and September.
Yes, I understand.
And then so but the timing of that will not be till probably June before we get some sort of a budget out, just so we know.
I understand that. The issue for us really, and we will be taking testimony from Nolan to look at what the latest information is. Hi, Nolan. Latest information is on the federal dollars, just to
Yeah.
know what's there and what it's to be spent for. Our job in our committee is really to prioritize some of the needs that we have heard about. So, is it spending money on PPE? Is it spending money on childcare, giving money back to parents who've been spending money on childcare and not benefiting? Is it money that falls into the need for mental health and support services? So those things that you believe we should be prioritizing as a committee,
Mhm.
and then we'll try to get a bead on what monies are available. But to be honest with you, you guys on appropriations are going to have to be doing a lot of rolling up your sleeves and thinking about that. So
Well,
I get it.
the use of the federal money is still a little bowl of pudding.
It is.
It's kind of like,
Well,
well,
we want to stratify the bowl of pudding.
I get it. I get where the priorities are, but it still is a bowl.
Yeah. But part of sorting out how the federal money is coming through is understanding how much money has already gone to providers, how much money's already gone to hospitals. And then we need to understand what the administration has done. I know mental health and DEVA and others have already spent some money in looking for reconciliation. A lot of that'll happen out of joint fiscal, as Ann said. But we need to know where that money is and where it's going, so that when we prioritize, we're not being redundant. That's all. So please, I'm imploring you to send me your priority list, and I really will make time. If we have time tomorrow, we can talk about this again at the end of the meeting. I see everybody shaking their heads. I'm hoping I'll see something come through. That's great. All right, or just let me know you have it and we can talk about it at committee. That'd be good. Because we will be sending a letter or two out. And Nolan, that's a heads up for you too. Okay, great.
Thank you.
Anything else, committee? Dick?
Yeah, at some point, we have bills in the Senate calendar. I don't think we need to do it immediately, but at some point, for example, I have a bill that I'm supposed to report, and it's been
Yes.
2 months. I'm gonna have to review my notes.
Won't be able
So-
to remember it.
Yeah, so I'll need a heads up on,
Yes, that
some
is,
discuss-
yeah, you're right. That's what the pro tem, he asked committee chairs to send a list of bills that were sort of top priority, and then bills that were lower down on the list didn't have to be passed. And I believe that all the bills that we passed out of committee, I remember if there were any that I didn't list as a high priority, simply because
Okay.
we worked so hard on them, and that most of them are on the calendar. A couple are in committee, one's in finance, and one or two are in finance, and the nurse compact bill is in finance. Why is that in finance, Senator Cummings? Do you know?
It may have had a fee.
Yeah, $6,000.
yeah.
It's really an appropriation. Oh, it's a fee. I don't know.
I don't know.
PFAS
We
is on
never
the
got
notice
to the bill.
calendar.
We just got out our bills. We never got to the ones that got sent to us.
So think about this. Think about that nurse compact bill as a priority bill for COVID, because we've heard from a number of folks that It does allow for greater flexibility for nurses to work.
Okay. I think we took care of a lot of that in emergency licensing
A
and,
little bit, but not
yeah,
the
okay,
multi-state, interstate. We did for
all right.
nurses, but we didn't for
I will
nurses.
get that on the,
I mean,
I
just
hate
look
to
at
admit
it.
that I'm not sure of the answer. Am I reporting that? I think that was mine.
PFAS?
Well,
PFAS?
PFAS, I know I'm doing, and I
Yeah.
think I did the nursing compact.
I'll double check.
Yeah,
You'll see it. We'll see it.
Hey,
Yeah.
Ginny,
Yes,
the bill that I have on the calendar,
yes, you
who-
do.
yes, who was the drafter of that? I
I
can't
believe-
remember.
I believe it was Jen Carby. That's the, is that stem cells?
I think so.
Jen Carby.
Jenny, do you get any, like at chairs meetings, any indication of when we're gonna start clearing the calendar?
No, that's what I was about to say. After we sent the list of bills to the pro tem, then on the other side, a similar action was taken, I believe, by the speaker, but at any rate, the speaker and the pro tem are meeting to look at where there's some common ground on bills and which bills we should be taken up. So
Ginny, is there common ground on the nurse compact?
I think there will be, yeah. I don't, because that bill is in finance, it's another step, but the House Healthcare Committee, it's my understanding, is supportive, and I would think
Why
that,
don't you check that? Because
yeah,
that would,
I'll double.
I think that not being controversial is one of the ways we're getting permission to bring it up.
Sure, that would be good. We can check with Bill Lippert tomorrow when before
Okay.
committee starts.
Yeah.
Do that.
And Jenny, do me a favor and check on who the reporter is on that.
On the nursing one?
Yeah, I think
Yeah,
I
it's
am. but
it's
been
either
a long
you
time.
or me. I think I might have it. I forgot.
Yeah,
Or it could be you.
I think I have
No.
a folder.
It could be Ann. No,
Me?
you have the emergency council, a commission, right? Okay,
Well, I think I have a folder with all my notes sitting in my Senate desk.
okay.
So I'm gonna
we're-
have to prepare. a
It's there.
recording.
We'll
Yeah.
we'll find it for you. You've got some time. You'll be good. All right. Any other discussion that you'd like to have before we move out? Wrap up. Okay, I will see you all tomorrow morning. We are on the floor at 9:30. I'll have Nellie send a note out that we will meet at 10. Apparently, it's a short floor session. I've also asked the pro tem to try and find some times in the afternoon so that our committee isn't totally co-opted every time, but Approps is going to start to meet, so we'll see how that goes.
You have the Senate meeting at 10, not at 9:30?
The Senate meeting is at 9:30.
Oh,
Our committee will meet at 10.
oh, okay.
Nellie, can you communicate with folks about that?
Yep, I'll send out a note about that.
Terrific. Thank
Should
you.
I have the code, the numbers, the ID and password? Should I already have that?
Not
No,
yet.
I haven't sent that out yet.
You have
No.
not said, okay, okay.
Okay. Let me just make sure I didn't. No, I didn't. Okay. Anything else? All right. I think it's harder meeting by Zoom.
It's,
Yeah,
Harder than what?
harder.
The meeting in person.
you know, what really is getting hard for me is my chair.
Oh my gosh, I have this, I don't know what it is in my hip.
So I'll tell you what we're going to do. We're going to
Exercises.
adjourn.
Hurts.
Nellie, you can take us offline. We'll adjourn and then we're gonna call it a
Nobody
day.
cares about
Okay,
it.
great. I'll
Bye-bye,
take us
everybody.
I'll take us
Take
off.
us away from being
tomorrow.
live.
All right, ending.